Hello, everyone, and welcome back to Mind Body Medicine for Chronic Pain. Welcome, welcome, welcome. Today, we talk about a lot of things, and we talk about how it's hard to internalize messages of safety, and that having very severe symptoms that are very triggering and very traumatizing, that being queer, that having severe attachment trauma, that being trans in this political climate, these are difficult situations, and it is hard to feel safe, and thus it is hard to heal from chronic pain. Ooh, yeah. Today we have a great conversation with Caryn Sherbet, and we get into a lot of great things, and like I'm saying, part of what we get into is this. I just want to preview this. To expect a few quick sessions of pain reprocessing therapy to fully cure you of your pain, that expectation may be, and I hate to say this because it feels like I'm sowing doubt and that this is an unhopeful message, but I want to be real with you. I want to be real about where our conversation goes today and just how reality goes every day. I'm not sowing doubt about the fact that you can heal from chronic pain. You can, and depending on your situation, to expect a few quick sessions of pain reprocessing therapy to fully cure you of your pain, that expectation might be very unrealistic. Okay. In this conversation, we get into we get real about some of the hard parts of this work. This episode is hopeful, and Caryn themselves has a super cool and hopeful personal chronic pain recovery story, but this episode is also we get into talking about how hard this can really be. Caryn gives a great example in explaining the situation for their trans clients who do not feel safe in this world. Of course, they don't feel safe in this world, right? How could they? Okay, and let me say this. Can we all, listening to this podcast, that means you and me and all of us, can we all please commit to trying to make this world a safer place for trans people? Can we all commit to that right now? And making the world safer for anyone. We do not want to be the villains in someone else's trauma story and someone else's chronic pain story. This is so important. The world needs to be a safer place for everyone. The world needs to be a safer place for trans people. You and I have the power to speak up for trans rights and for trans people's humanity and for trans people's right to exist. So do it. Okay? Okay. So, okay. Today we get into the hard parts of this work and we get into the idea that your pain may not be easily cured. However, you can, with the pain reprocessing mindset and the TMS mindset, you can do the things you want to do. And, of course, your pain really can go away. And if it's not going away, at least it can decrease. And it can decrease a lot. That is possible. But it is hard to fucking feel safe. It is hard to fucking feel safe. Yeah, but we're working on it. Okay, let's talk to Caryn. Hello, everyone, and welcome back to the Mind Body Medicine for Chronic Pain podcast. I am here with Caryn Sherbet. Hi, Caryn.
Hi, Sean. Thanks for having me.
Absolutely. Thank you so much for being here. And why don't we start with you introducing yourself? Tell us a little bit about who you are and what you do professionally, certainly, and if there's anything you want to include that you do personally, that is cool as well.
Sweet. So I am a Brooklyn-based psychotherapist, and as of a few months ago, a certified pain reprocessing therapist. So my specialties are OCD, sex therapy, and chronic pain. Which when I say them together, people are often like, do those things have anything to do with each other? And I'm like, aha, yes, they do. Um,
Yes, I love that because 'cause I'm like, so fun, and so fun. 1, 2, and 3. We've got a lot to talk about, so go
yes,
on.
yes. So those are my specialties. They have significant overlap. I work with predominantly queer and trans people, which I love. And also queer and trans people tend to have a lot of OCD, sexual trauma, and chronic pain. Um, so there's
Yeah, yes.
much to work with there. Um, yeah, I think that's kind of the basic overview.
Awesome, awesome, very cool. And, I know that you had we were int I was introduced to you by listening to Deb Malkin's podcast, and Deb was on this podcast a little bit ago, pretty
Yes.
recently, and then me and you talked, and now here we are doing this. And so what I know from what I know about you is that you had, of course, your own journey with chronic pain and recovery. So, why don't you start by telling us a little bit, whatever feels comfortable about that journey?
Yeah, well, it's so funny because I saw your email go out in the Manhattan Alternative listserv about the interview you did with Deb, and I immediately started. I was like, "Oh man, I can't wait to listen to this." Um,
A good one.
yeah,
It's a good one.
I have no doubt. I'm very excited. Yeah, so I came to. I'm just going to refer to pain reprocessing therapy as PRT for the rest of this, probably because it's less of a mouthful. I came to PRT through my own, chronic pain journey. I guess like almost 2 years ago at this point, I kind of have like a bunch of like converging chronic pain histories that all kind of came to a head at the same time. The thing that like really was bad was in the spring of 2024, I kind of woke up one morning with really severe neck pain um,
Mm,
that just would not go away pretty much no matter what I did. And I had sort of like week-long episodes of that before, but it would always go away, and this time it wouldn't. Um, and it was pretty debilitating. Like, I'm a therapist. My whole job is to like sit up and talk to people all day, and I like couldn't. It felt like I couldn't like hold the weight of my head up most of the time.
wow.
So I would like do sessions like laying down. Um,
Yeah.
which was not great. Um, and then, sort of at the same time that that was happening, I was also experiencing these weeks long episodes of just a bunch of really weird neurological symptoms. Um,
Mm,
like, again, I kind of woke up one morning and it felt like I was having a really weird hangover, even though I hadn't, taken anything. Like I
mm,
had light and sound sensitivity, and and I was like having like tremors throughout my body and headaches and really intense fatigue. It felt like there were like kind of bees buzzing under my skin all the time. Um,
wow.
so that and the neck pain kind of started on a pretty similar timeline.
I just wanna say it's wild the range of symptoms that are TMS and neuroplasticity based, like bees buzzing under your skin. Wow.
Yeah, some of those are the ones that are like I've had some really weird ones, like the bees buzzing under my skin. Sometimes it feels like my like insides are made out of like lava lamp. Like I can like not like feel my blood moving, but it like feels like there's like something moving in there in a way it definitely should not be.
That's such a good description. Having never experienced that specific symptom, I'm like, I can imagine
Yeah.
what that would feel like.
Yeah.
Wow.
Yeah. It kind of feels like you've taken like a really trippy edible, when you're kind of like,
Yeah.
"Oh, wow, my body feels crazy," but you're totally sober.
Sure.
Um,
Right. And you're trying to, like, work,
yeah,
for
right, and
example.
you're trying to be like, "I'm sorry, and what did your mom do to you last week?"
Right, exactly. Stay engaged,
Right,
stay
right.
engaged. But yeah, so you had multiple different symptoms that converged.
Yeah, and then it kind of, I was, getting all these, I was like, getting x-rays and MRIs and going to, neurologists and like spine specialists and acupuncture. And then after like almost a year of that, a doctor was like, we have no more medical interventions left for you to try. And so I was like, okay, screw it. I'll try PRT, something.
Mm. Well, let's. How did you even hear about PRT? Because a lot of people don't even know that's an option. You
Yeah.
know.
I have a friend who has complex regional pain syndrome,
Yeah.
um, which honestly I will do a disservice to if I try to describe it.
Sure.
But it's just
Yeah.
like you are in sort of increasingly horrible types of pain pretty much all the time, from what I
Yeah.
understand.
I bet there's people listening to this podcast who've probably been diagnosed with that.
Totally. And when I was sort of like, throughout this sort of chronic pain journey, I sort of realized that I had very little relationship to disability justice at all. I knew very few, or I thought I knew very few people who were also chronically in chronic pain and chronically ill and disabled. And so a big part of my kind of coming to PRT was connecting with more, disabled and chronically ill folks, which has been honestly a total like godsend and life raft.
Mm, mm.
And they were like, yeah, this helped me a lot. It might also help you. And then I think I literally Googled pain reprocessing therapy for trans people.
Yeah. That's awesome.
um,
Yeah.
because I was like, if I'm gonna do this, I've got to work with another trans person.
Sure. Yeah.
Um, and I found a lovely, lovely PRT therapist, Christina Armanakis, who is based in California. And I worked with them for 4 months, 6 months, maybe.
Cool.
Um,
Yeah.
and now my neck pain is pretty much completely gone.
Awesome.
Um, and the neurological symptoms, I finally got diagnosed as functional neurological disorder, or FND.
Mm, mm,
Um, and I still have episodes of that like semi regularly, but
mm,
the symptoms are significantly less bad than they used to be. And
mm,
now that I sort of know about PRT and I've been on kind of both sides of it, um, when I have an episode, I'm just kind of like, okay, I know what this looks like. I know what this is going to mean for the next week or so. I know how to like take care of myself through it. So it's
mhm,
super different than it was, 2 years ago.
mhm. That's also awesome to hear. I mean, something like what you're talking about. Um, it's awesome. Are you saying that like while the symptoms have not gone away, like the neurological symptoms, that it's A, you are better at dealing with them, and B, the symptoms are milder? Are those both true,
Yes.
or is it not real?
Yes.
Okay.
Yeah.
Good, great.
Yeah. Yeah.
Good. I hope everybody listening is taking that in. Like, listen to that. Isn't that a
I
good
think that's
outcome?
hmm yeah, actually the worst that the neurological symptoms had ever been was that very first episode, because
Mm,
the whole time I was like, what the hell is happening? Am I having a
right.
stroke?
Oh,
Um,
that's horrifying. Yeah, very
right.
horrifying. Yeah.
And then when I had the next episode, like a month later, the symptoms were still not great. But I was like, well, this happened to me last month and I didn't die.
Yeah.
So this must not be so bad. And that helped.
Right.
And that made the symptoms less
Yes.
intense.
Right. And right. So what I'm hearing is like some messages of safety.
hmm
So talk to us about, when you as a client in PRT, learning this for yourself, do you want to say a little bit about like what were the changes that you made? What were the mindset shifts that you made, the practices you engaged in? Because, certainly many people coming to this podcast, that's what they're here for. It's like, please advise me. I need help, you know?
Totally. So it's interesting because I did PRT training in March of this year of 2025. It's like a month-long training. And
Yeah, we must I did it I think I did it maybe it was November. It might have been, like, just exactly a year ago that I did that, so we just missed each
nice.
other. But
Yeah,
we probably did the same training.
yeah. Yeah, so I did the training in March, and I was sort of at the tail end of my own PRT treatment as I was doing the
Mm,
training, which was
mm,
really interesting, because I was still kind of learning a lot about PRT, both from my therapist and from the training. Um, and the thing that I kind of say to people is like, PRT is kind of full of a lot of like lessons, and I learned every one of them the hard way.
yeah. I'm still learning lessons the hard way.
Amen.
Shit. Like,
Amen.
yeah.
Yeah. Yeah. Um, I had like a couple of like extinction bursts, which I didn't know what that was until I did the training. And I was like, oh, okay, that sucks, but I know what that is.
Mhm,
Which
mhm.
is basically just a thing that they talk about that as you do, the longer, the sort of further you progress with the PRT, at a certain point, you might have what's called an extinction burst, which is,
Yeah, 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 yeah. Give that to us.
yeah.
Let's do it now.
I
Go
also just
ahead.
I love the language of extinction burst because I'm like, ah, yes, we're still using the language from the 70s around like behavioral extinction. I think is really funny. um,
Yeah, I guess that probably is where that comes from.
yeah,
I never made that connection, but that's
like
hilarious.
BSNR is still in the chat.
That's right. That's right.
um, but the sort of, as you've developed more PRT skills and your pain starts to die down, sometimes your brain, your body will give the pain one last push, as it's kind of on the way toward being sort of kicked for good. Um, which is exactly what happened to me, where I was like having, several weeks of no pain at all, and then would have like a week of really intense pain and be like, What the hell is happening?" And because I didn't know what was happening, I was like, I'm doing PRT wrong. There's something wrong with me. This is never going to get better, which is kind of a death knell to PRT progress.
Mhm.
Um, but then when I learned, I was like, no, this is a thing. And also, you're not doing PRT wrong. And also, every time you get anxious about doing PRT wrong, it actually makes the pain worse.
Yeah, no, that's so helpful for people listening. Um, I have had I actually I did a podcast episode about what it was called My Latest Journey Through Doubt, and it was about an extinction burst. And I'm like, I am still to this day still that person where when my hip is the symptom imperative that like has not fully let go yet. And like right now, I'm sitting here, I've got like a little tension in my hip, totally fine. If this were how I was all the time, I would never I'd be like, who cares? You know, like I think I feel good. But when it hurts, it's still, it will still act up. And when it hurts, I will still get in the mindset of like, oh my God, nothing's working. This has never gotten better.
Right.
All these times that I believed that my chronic pain was gone, I was crazy because clearly it's still really bad. And then I'll come out of it and I'm like, what the hell? So thank you for sharing that because that's obviously it's a normal experience if both you and I are experiencing it.
Yeah. Yeah. That honestly, the thing that was the hardest for me in my whole PRT journey, and is I think the hardest thing for my clients, is the perfectionism piece. Because
Yes.
that's something they talk about so much in PRT, is people who are prone to developing chronic pain are perfectionists because your
Yeah.
danger system is on such high alert all the time. And then you bring that perfectionism into PRT and are like, why isn't it working? And
Yes.
it's super hard to let go of.
Yeah. Yeah. Right. Right. It's very hard to let go. I that's one of the things that I sometimes I actually sort of struggle to talk about in this podcast because like, I talk about the like work that has to be done, like I frame it as like the psychological work of like calming the nervous system, teaching your brain and your body that it's safe to feel physical sensations, the emotional work, teaching your brain and your body it's safe to feel emotions, and then the work of attuning to your true self, like teaching yourself that it's safe and okay to be you. And I always frame this as like work because it is. I mean, it really is work. And yet, sometimes the hardest work, in air quotes, is not really work at all. The hardest work is to calm the fuck down. Which is that's really hard for me and really hard for a lot of people, of course.
Yeah. Yeah. I think one of the places where, chronic pain treatment and OCD treatment to kind of dovetail really beautifully is so much of OCD treatment is learning to tolerate essentially existentially intolerable phenomena and experiences, right? So things like uncertainty, things like fear, doubt, uh, risk, loss. So much of that is wrapped up in OCD treatment, and it is really, really hard for people with chronic pain and people with OCD to like do nothing. And so much of the time, that's actually the thing that's going to be healing. I think, especially with chronic pain, and with OCD, is doing nothing and not trying to fix or solve. Um,
Mhm.
and that is incredibly hard because it makes us feel deeply powerless and out of control. And we hate that. We hate that.
Amen. Amen. Well, okay. So this is perfect. But let's get into this because when I heard you on Deb's podcast, every time that I hear a podcast that I really like and I'm like, I need this and I need to come back to this, I will save it. And you said, I forget exactly what it was, but it was something along the lines of like when I was trained to work with people with OCD. I mean, you'll say it better than I will, but it was something along the lines of like, don't let like the central question to ask is like, what do you really want in life? And how is OCD holding you back from that? And I was like, save for later. Come back to this. So talk to us. I mean, I don't know if that's the exact quote. Talk to us about your training in OCD. Like, let's go there.
Yeah, I mean, that's pretty much verbatim the quote. Um, so I work at a group practice that specializes in OCD treatment for queer and trans folks, and my brilliant boss Andrew Triska trains us all in exposure and response prevention, or ERP, which is considered kind of the like quote unquote gold standard for OCD, and Andrew also really, really loves existentialism and existential therapy. So the way that we sort of learn ERP is there's like a lot of skills work involved, but it is more of like a life philosophy that he kind of espouses and tries to get people to buy into, which is basically you can't avoid suffering
Yeah.
in life. Um,
Yes.
but you do get to choose what kind of suffering you endure and to what end. And so
Mm,
that's where the sort of the two guiding questions of what do you want out of life and how does OCD get in the way are used to guide treatment.
mm. And the clients who you've worked with this paradigm, what kind of examples like what do people say, when you ask like what do you want out of life?
It varies a lot, you know.
I bet.
For some people, it is like these sort of bigger existential things of like, I want to be, the sort of like truest, most authentic version of myself, or like I want to live a life that is aligned with my like moral values. Um, or it's things like, I want to like feel comfortable going to a coffee shop and reading a book alone,
Yeah.
or, you know, orgasming in front of a partner.
Yeah.
Um, so it really varies from these kind of like high level conceptual things to then also day to day. I don't want to spend X amount of time washing my hands until they bleed every day.
Totally. Right. Totally. Um, well, and I wonder, like, as so in doing OCD work and PRT work, and you're saying, like, as a sex therapist, this really all goes together. So let's get into that. And especially, like, one thing that I love about the podcast I have is that it's rated explicit. You have to like log in to listen. So like we can talk about whatever the fuck. So in the spirit of going there, let's let's talk about that.
Yeah. Um, So, oh my God, there's so much to say. I could talk about this for hours and hours and hours, but I think the big thing that kind of really unites all three specialties, the OCD, the chronic pain, the sex therapy, is avoidance,
Mhm.
emotional avoidance. And that's kind of what it sounds like, which is quite literally, we do not like experiencing our feelings.
Yes.
It's actually just talking with someone about this. We, especially in this culture and in this country, we are not given any framework at all for how to feel a feeling without trying to change it into something else.
1,000%.
Uh,
I just wanna
yeah,
stop
yeah,
on that
yeah.
1,000%. Like, we had in my high school, in my Catholic high school, we had this, like, what they sort of framed as, like, cutting edge program that was called TLC, Thinking, Learning, and Communicating, and it was honest I loved it, like, at the time.
Sure.
This is me as, like, a 14-year-old, loved it. It was like I took it my freshman year and was like, "Oh my god." It was, like, all like, kind of like skills for life, skills for, like, how to think and how to learn and how to communicate. And, I wonder what half the skills were that they taught us, I don't remember, but some of them I do remember, and they were literally this in this program that was considered to be sort of the cutting edge, we're doing, like, social emotional learning for, like, teenagers, and that's so cool, no one ever does this because all we teach is, like, math and English and in my school, religion and whatnot. So and it was like, yeah, it was cutting edge and it felt cutting edge, and yet it was exactly what you're talking about. I mean, the skills we learned some of the ones I remember were like how to get out of a thought tornado, which is like, if your thoughts are like spiraling out of control, like how to get out of it, how to ease up on a negative belief. And I literally remember that one. I was like, I don't get that because like people would just say like I believe this negative thing about myself, but then I eased up on that belief. I went from a 6 to like a 2 on that belief and now I'm better. And I remember as like a 14-year-old being like, but how? So anyway, I just want to like, yeah,
Yes.
we learn about emotions. We either don't learn about emotions or we do learn about emotions in a way that's just about how to make them go away.
Yes. Yes. Again, I have so many thoughts about this, but something that I've been thinking about in particular a lot lately is PRT is really interesting because the way that it works, right, is you're not trying to make the pain go away. You're actually focusing your kind of gentle attention on the pain. And the longer you can stay present with the pain, the more it's able to transform into something else. The more that your fear around it is able to transform into curiosity or neutrality or whatever. Um, and I've kind of started taking that approach to the work that I do with my clients about things that are non chronic pain related.
Mhm,
I feel like where the sort of like therapy culture is and has come in the past 20 or so years is that CBT is sort of the dominant model of therapy.
mhm.
And I have, feelings about CBT. Um, but I think for OCD specifically and for like emotional avoidance in general, CBT can be really harmful because it is a way of um, providing reassurance um, to something when reassurance is actually the thing that perpetuates the avoidance, right? Because CBT is a way of saying, of like, oh, well, if X, if a shark isn't actually going to fall through your ceiling, then why be afraid of it? Um, right? Which,
Right,
to anyone who's ever had anxious thoughts knows the more that you try to reason with them, the louder and the worse they get. Um,
right,
versus I think PRT and ERP are more like, yeah, that would be fucking horrible if a shark fell through
right,
your ceiling. It doesn't matter how unlikely it is. We acknowledge it would be horrible.
right.
And so something I've been thinking about is, one, allowing for the full breadth of human emotion to exist for my clients. And that actually, I think the way toward moving through things like shame and guilt and embarrassment is to let my clients feel them without putting stock in the beliefs attached to them, if that makes sense.
Yeah,
Like
that totally makes sense.
really trying to separate out the feeling and often the somatic experience of that feeling from the sort of intellectual content of the belief, kind of in the same way that PRT treats pain and sensation.
That makes a lot of sense. And what I'm hearing is like, for people listening, I'm thinking like if the classic CBT answer to a problem is like, don't think about it and then you won't have to feel it.
Right.
The the a much better way is what you're talking about, like a PRT lens where it's like allow yourself to feel it. Don't be afraid of the feeling. It's okay. And you can also acknowledge, like, and a shark's not gonna fall through the
Right. Right.
ceiling.
Yes. And I think that's also like a very kind of borrowed from DBT, right? Like these two different things can be true at once and we can hold them to be true at once. That like it is perfectly fine and normal and healthy to feel very afraid at the thought of a shark falling through your ceiling and acknowledge that that's probably not going to happen.
Right.
And so, you probably don't need to buy like shark insurance or whatever. You can have a
Right.
feeling. You can also, another thing I talk about with people is like you can feel a feeling and not act on it, right? You can feel fear that a shark is going to fall through the ceiling and refrain from buying additional insurance or moving apartments or, whatever.
Right, right, in the similar way that you can feel pain in your body and think, "Oh, I shouldn't go do this or do that, or I can't, go run now, or I can't do this." When, okay, that's one choice you could make, or you could do it anyway.
Totally. Exactly.
Okay, but let's do, like, a brief I think this is important to talk about. Let's do a brief sidebar into CBT, and I'm curious what you think because like, I'm like, "Let's go there." For people who maybe are less familiar, cognitive behavioral therapy, that is CBT, based I mean, the way that there's cognitive behavioral therapy is like a skills-based kind of therapy. It's focused on thoughts, behaviors, and feelings, and I always think of, like, the basic underlying assumption is, like, it's like your thoughts, feelings, and behaviors are all related to each other. They all one causes the other, and they, like, have a, interplay between all 3. It's hard to just change how you feel, but you do have some control over how you think and how you behave. And so if you make changes in your thoughts and your behaviors, you can influence and change how you feel. Um, a lot of times CBT is criticized for being very surface level, and a lot of times, unfortunately, it is. And I think my understanding is that CBT came out of an era where the treatments that were being used before CBT were like long-term psychoanalysis. You're in therapy for months and months, if not years and years, maybe decades, multiple times a week, laying on the couch, not much happening, not much traction. And so CBT really is, I think the good thing about CBT is like it's really trying to, like, make some change and make some change happen faster than that, which is, like, that's cool. That said, um, there are now newer therapies, that have come to sort of replace CBT, and I would just recommend for people listening to the podcast, if you're looking for a therapist who has CBT as, like, part of their skill set is awesome, and most therapists are trained in CBT in some way and use CBT in some ways, awesome. A a therapist who strictly relies on only CBT, I would not choose that therapist, especially for chronic pain. But what you talk to us. What do you think?
I think that's a super helpful distinction, and I'm glad you said it. Yes, I understand the context out of which CBT was born, and like there are some, of course, I think really helpful skills in there, right? The first type of therapy I ever did as a client was pretty traditional CBT, and there were pieces of it that were really helpful. Um, there were also pieces of it that I then had to spend more time in other therapy unlearning. My thoughts on CBT, especially for OCD and also kind of in general, is that it feels to me like a very top down approach to to
Yeah.
therapy, right? Like if you change your thoughts, then you can change your feelings.
Yeah.
Um, and I think we just kind of know at this point in time that's not really how feelings work. And I think is kind of part of this broader culture that we were talking about of how none of us have really any framework or conception for how to feel things. And I think that CBT is a big contributor to that being part of the like current understanding of therapy and how like
Yeah.
people should be. Um,
Yeah.
and of course, like being non-emotional, quote unquote, is deeply intertwined in like capitalism and imperialism and
Yes.
and you know patriarchy. And so I also take a lot of issue with CBT as being top down, not only for the client, but also from therapist to client, because I think
Mhm.
CBT requires a level of like, well, if the therapist says you shouldn't worry about this, then you shouldn't worry about it.
Right.
Right. And then we sort of start to get into like the power dynamics that are being replicated from, sort of larger society to therapists or, institutions to therapists, therapist to client, client to themselves. Um, and whereas, things like IFS and PRT and ERP and ACT have a much more bottom up approach. If you kind of start with what is actually happening in the body and you work to sort of honor it from there, as opposed to a very sort of intellectualized part being like, well, this is what we want to be doing. So we're going to push everything into a box to make it happen.
Totally. Totally. Yes, thank you for saying all that. Um, and I'm thinking if therapy feels, like the power dynamics you're talking about, if therapy feels like an exercise in like listen and obey for anyone listening out there, if that's your experience of therapy, that's not helpful.
No.
That's not helpful. I mean, listen to yourself. Not listen to your therapist and obey their orders. Also, it is unfortunate that a lot of therapy, yeah, falls into what feels to me as like the how can we get insurance to pay for the least amount of sessions? How can we get them and like getting the best outcome in the least time? Great. Who doesn't want that?
Right.
But but that's like easier said than done. And life is mysterious and the brain takes time to change. And the idea of like how can the insurance company pay for the least amount of sessions and then get the client back to productive work as soon as possible is just like really like is this what our society is really about? And unfortunately a lot of times yeah it is.
Right. Right. I mean, like, yes, that is what society is about. And that's why I kind of think it's, um, why it feels like sort of somatic work and PRT have become increasingly important to me. Um, as a way of like really being connected back to one's self as
Yeah.
much as it's possible to and under late stage capitalism whatever, um,
Yeah.
but really honoring what is happening in a person's body and what they actually really sort of need from themselves to like take care of that body. um
Yeah.
yeah, has become just increasingly important in the year of our Lord 2025.
Yeah, for sure, for sure. Well, let's spend a little more time talking about sex therapy and the connection there. Like, talk to us about, how did you get into being a sex therapist? Tell us about that.
um, I have been obsessed with sex since I was like 14.
Awesome. I think many people feel the
Yeah,
same.
famously. Yeah, yeah. um,
You're just out there willing to say
yeah, I was like, am I gonna say this? And I was like, yeah, fuck it, whatever.
it.
um,
You're not alone.
yeah. Um, I think just I've always been really fascinated by all of the different scripts and rules and cultural understandings around sex. And then as I've sort of gotten older, not just sex, but like these sort of bigger, more existential ideas of like desire and the erotic and power and freedom and pleasure and all of these different things. Um, and so I've kind of known that I was going to end up here for a very long time. Um,
Cool.
and Doing sex therapy is one of my favorite, like most favorite things on God's green earth. Sometimes I have to remind myself that, when clients come in and they like want to do sex therapy, it's like very scary and vulnerable for them because they'll come in and they'll be like, I want to talk about, I want to talk about like tying my boyfriend up. And I'm like, like, I just get so crazy. I just get so excited. But I have to like remind myself, like, okay, this is sensitive. This is vulnerable. You have to,
Sure.
but also I have a very expressive face that does not hide anything. So it's pretty obvious when I get excited.
That's awesome, and I'm sure that's helpful because how many people are so scared to talk about sex, and I'm sure for a client to see your face like, "Yes, let's go," it's a good invitation, I'm sure.
You know what?
But
I
go
hope
on.
so. I really hope so. But yeah, I think, you know, for me, the thing that's one of the things that's most interesting about sex therapy is this question of what does it mean to have desire and what does it mean to act on it? Um, and what do we sort of have to sacrifice to do that? Um,
Mm,
and I think, especially at this point in time, as someone who is queer and trans and like in the leather world,
mm,
you know, I've thought a lot about this idea of sort of sacrificing in the name of desire, which I've done quite a bit of, um, and
yeah,
getting to help my clients do that, whether it's on the scale of like, I want to tie my boyfriend up, or, I want to orgasm in front of a partner, or, having a severe sexual trauma history and wanting to have just even like a neutral relationship to one's own body, right?
yeah,
Um, to me, it's just just sacred work, genuinely.
yeah, 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 yeah. And when you say, like, what do people have to give up? Like, I think I know what you're talking about there, but say more about that so I know, like, if we're on the same page.
Yeah. How do I want to say this? I think we all sort of get raised with these particular like scripts and tropes and understandings and ideas of what it means to have sex and be a sexual person and like engage in sexual relationships. Um,
Mhm,
and the majority of us do not fit into that script of right of like
right.
being heterosexual, having sex for marriage, being vanilla, being monogamous, being,
Mhm,
if you are like a man, then you are sort of dominating and interested in penetration. And if you are a woman, you are like submissive and interested in being penetrated, right? These are all of these kind
mhm,
of, and then there's, not even getting into things like the, Madonna horror complex and the,
mhm,
different double standards and, the fact that all these scripts only apply to quote unquote men and quote unquote women.
mhm,
Um, And I think it is both very freeing, but very painful to come to grips with the fact that you do not fit cleanly into those boxes, any of those boxes, any of those scripts. And so there
yeah,
is almost a bit of like you know, entering the matrix a little
mm,
bit of
mhm,
like essentially I'm giving up or I'm sacrificing this facade or this understanding that I've had about myself for a long time that um, might not be true in order to move toward what it is I really want or think I might want or I'm interested in wanting. It
mhm,
is
mhm.
terrifying.
Yes. Yeah, yes. Okay, so yes, we are talking about this, or I'm thinking about what you're talking about. Yeah, um, I'm so glad you're sharing that because yeah, I mean, that's been A, so true for me, like, as a gay man. B, sure, I mean, so true for so many people, like, very true for queer people, and you don't even necessarily have to identify with the queer umbrella to have the experience of what you're talking about with sex. And then C, even larger than that, I mean, that's such an important, part of chronic pain therapy that I'm always, you know what I mean? Yes, that I'm always trying to help my clients with, and expressing on this podcast, is that if you are trying to be who your family of origin wants you to be, or who society wants you to be, and that's not you, you will always be scared of the quote unquote bad self, which is the true self, the self that doesn't fit into the boxes, the self that doesn't like it like that and actually likes it like this. And you will be always repressing that self, which will then lash out at you internally, and that could cause chronic pain. Or you're always putting yourself in the wrong situations for yourself, which makes it like it's like setting up a threatening situation for yourself. If you're always overextending yourself, doing what you don't want to do, not listening to yourself, you're putting yourself in a position where like you, the true you inside you, is is like in danger of being like not listened to, overtaken, not taken seriously, overwhelmed, doing too much, doing stuff you don't want to do. So it's like, this is so chronic pain related. I hope people listening are like, yes, we are on topic because it's so related. But what do you think about that?
Yeah, I mean, I think one of the things, oh God, one of the things that has been really difficult about my own chronic pain journey is I've been having chronic pain since I was probably 12.
I feel you. Same, same. 6, maybe. I mean, symptoms wax and wane,
Sure.
obviously, maybe young. I mean, honestly, even younger, maybe. Li- Life journey.
Yeah,
I'm with
yeah,
you. Life
yeah.
journey.
Um, and, the sort of facade is like, I don't have chronic pain,
Right.
right? I'm not disabled. I'm not in pain all the time. I mean, when I was in middle school, I would have to every month, like clockwork, my periods would get so bad, I would have to like miss days of school because I would get so sick. Um,
Mm,
and I was just like, oh yeah, this is just like normal, like women are in pain. Um, and I had actually quite a lot of grief about then becoming trans and being like so much of my experiences with pain have been under this guise of like, to be a woman is to be in pain. And for me, healing from chronic pain has been deeply intertwined with also my like gender journey because
sure. Yeah.
when I started not being a woman anymore and I was still in pain, I had this really I think that was actually kind of the like watershed moment for my body when when my body was just like, we can't fucking do this anymore.
Mm,
Like we can't pretend like we're not in pain. We can't pretend
mm,
like we're not trans.
mhm,
And I think for me, that was a really huge kind of point of no return
mhm,
in really looking at my life and looking about. Like I remember when I was in high school once and I started having like weird neurological symptoms when I got my period, which is how I ended up getting diagnosed with FND, 12 years
mm,
later.
mm,
Um, Being so dizzy one day in school that I had to like that the thing of like the walls are spinning, right?
wow.
I had never experienced anything like that. It was crazy. I've never experienced anything like that since. Um,
Wow.
and I was just like, I got my period the next day, and I was like, oh yeah, okay, that's about right. Mm.
Wow.
So yeah, so the shedding of the like coming to grips with like I'm trans, I'm disabled, I'm
Mhm,
queer, I'm a freak, these
mhm.
different things, it was brought up a lot of grief.
Yeah, right, right. Like we are who we are, and there's not a ton of control we have over that. And that's something that I hate, and is all you know what I mean? But it's also like that is life. What can you do?
One of my colleagues yesterday said something that was so great. That was like, she was like, "Yeah, I forgot that I could hate distress tolerance as long as I was actually doing it." It's like so true, queen. Yeah, it sucks.
I love
It's
that.
the
I
worst.
love that mentality. I love it. Okay, and let me ask you this also. This I'm so glad we're talking about this because this is something that I have stressed about. The disability component of this work because I get very stressed, I would say, that like some of the message of this work and of the podcast I'm putting out and of like the work we do with like PRT and neuroplasticity and mind body work, some of the work in this field is kind of like it's kind of like you're not disabled. Get up out of the chair and just live your life. You're fine. And I'm like, I don't I don't even know what to think about that. I'm like, some people who may identify as disabled may really not be or need to be. Some people obviously are, and like I don't get to decide. But like I'm glad we're having this conversation because I'm like I don't even know what to make of that. Talk to us about that.
Oh God. Again, this is something that I have so many thoughts and feelings about, but
Yeah.
something that I've been noticing, so I did the PRT training and then I did the you can do sort of like the like advanced application training, which is like a
Right.
small group kind of like peer consultation for
Yeah.
6 weeks. And so I did that as well. And I found that to be really useful because um it was full of a lot of people who were fairly skeptical about some of the aspects of the training. Namely, there are some, I think there are kind of some pieces of the training that are very like, do PRT and you'll never be in pain again.
Right.
Or like, right,
Right.
like get up out of the chair and you'll be fine. Um,
Right.
and there is
Right.
somebody in my consultation group actually who has complex regional pain syndrome and works predominantly with other folks with that diagnosis and was saying like managing expectations and sort of reframing some of the beliefs around pain and healing from pain. And I think I've been thinking about something similarly, which is that I work almost exclusively with queer and trans folks. I work with a
Mhm.
lot of folks who have pretty severe attachment trauma.
Yeah.
And so when you're talking about attachment trauma, um, the worse somebody's attachment trauma is, often the worse their chronic pain is. Um,
Right.
and so I'm not sure if that exactly answers the question.
No, that totally makes sense. Yeah, what I'm thinking is like that right, like for people listening, like yeah, if your journey is long and hard and still you have pain and symptoms, like yes, know that that is normal. You're not alone if it's like oh, a couple sessions of PRT didn't like fix the problem or reading the book didn't fix the problem. And yet this stuff really does work and it really is helpful. And um you have to know that this can be a long game. This can be something you're dealing with for a long time, and it also can get better. Like I mean, how do you speak to that duality?
Yes. So that's actually kind of what I was just thinking is like, again, it really kind of comes back to the thing I said at the beginning, which is you can't avoid suffering,
Yes.
right? And, they love in the PRT training, they love to sort of tout these like wonder stories of like, this person just learned how PRT worked and immediately their pain went away. And I'm like, that's so cool. Have you ever met a trans person before?
Yeah, totally.
Like,
Yes.
um,
Right.
it's kind of so much of the work with PRT is internalizing messages of safety, and
Right.
it's really fucking hard to do that right now.
Right.
And I struggle sometimes to tell my clients like you're perfectly safe because we both know that yes, in this exact moment, right, nothing's gonna harm you, but
Mhm.
the second you walk out that door, I don't know. Um,
Right. Yeah.
so I think the thing that I come back to, right, is that you can't avoid suffering, but you can choose which kinds of suffering you want to endure and to for what outcome, right? If your pain is so great that you can't do the things that you want to do, um, I'm not going to be able to cure you of your pain, but I might be able to help you make it so that you can like go at a body hack or,
Right.
like go be able to do your job without being miserable the entire time or be able to hang out with your friends and feel mostly present during it.
Right. Right.
So I don't know, I value a lot the like little progress and also really orienting toward, PRT work is really hard.
It is.
Again, what do you want out of life and how is the pain getting in the way? How do we
Mhm.
orient treatment so that you're working toward something that will make your life better, fuller, less annoying, whatever it is?
Yeah. Yeah. Um, to me, I think it's so important to hold on to the fact, truly the fact that if the pain and symptoms you're dealing with are neuroplastic and they are TMS and like, pain reprocessing therapy and mind body therapy is the solution for you, then there's nothing structurally wrong with your body that means you need to be in pain. You know, if you are in pain, yeah, okay, we need to take that seriously because that means there's like emotional material or there's so much fear and there's obviously a danger signal of some sort. So it's like, yes, we need to take that seriously. And it doesn't mean there's anything wrong with your body. So that in itself is so freeing.
On the one hand, I agree. And on the other hand, I'm thinking about someone I work with who has a central sensitization
Mhm,
diagnosis, which I think is
mhm,
understood to be fully neuroplastic.
mhm.
And, I'm thinking about like this person has really intense complex trauma and complex medical trauma and
Yeah,
how hard and how scary it is to believe that there's and is also trans.
yeah.
And I think when those things all kind of overlap, um, and you've spent most of your life feeling like you're in danger in some capacity,
Right. Right.
really how hard it is to believe that there's nothing wrong with your body. Even though, like,
Yeah.
I agree with you, right? Like,
Yes.
I know that what she's working with is neuroplastic.
Right.
It's incredibly hard for her to believe that. And I think toward the beginning of working with her, I would get kind of frustrated because I'd be
Sure.
like, well, why don't you believe me?
Right.
I'm
Right.
showing. I know the science. I'm showing,
Right.
the fMRI scans, right, that we all
Right.
look at. Why don't you believe
Right.
me? Um,
Right.
and I think I've gotten to this place more recently where I'm like, she actually doesn't have to believe me.
Yeah.
Like
Yeah.
I would love if she believed that there was nothing wrong and then all of her pain went away. That would be awesome. And
Yeah.
also, like, if that's not what she wants or that's not what she's working toward or that's not what she like has
Yeah.
capacity to do, like, okay, I'm going to work with whatever she's able to work with now, right now.
Yeah. 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 Right. Right. It's funny, and there I hear like the pull towards listen and obey therapy where
Yes.
you're like, but I know
Right.
it's a neuroplastic condition and I can tell and I know about this. So I know you can be doing so much better. But this person right now where they're at, it sounds like can't. They could, but they can't. You know what I mean?
Yeah.
Yeah.
No, the call of the listen and obey therapy is very seductive. And I'm a human. I have parts of me that are sometimes like, oh my God, why won't you just do the fucking thing
Oh, same,
already?
same,
Um,
same.
but those are also the same parts that kept me in chronic pain
Right.
for a very long
Right.
time.
Right. No, totally feel you. The thing that kills me as a therapist is because I'm usually pretty chill and patient, and yet a lot of my clients are not. So
Mhm.
they're like, which I totally understand because it's like they have really in some cases bad symptoms, and they're like, I need help now, and especially like early, like people who call for consultations and stuff like that. It's like people are really sometimes in a very very desperate place, and you know, I I want to help them. And so I get into listen and obey therapy myself. And I'm like, well, if you want results, listen and obey. but but as much as a part of them wants results, a part of them doesn't, they don't believe this and they're not ready for it. So yeah, totally feel you. Okay. I'm sure we could literally talk about this for fucking ever, but we should wind down. Um I'm sure people listening are like, I'm sure in this audience we've obviously got chronic pain sufferers, surely OCD people, surely people who would benefit from sex therapy. I'm like, you're looking at somebody who needs all three. It's life is long. There are many chapters.
Totally.
Um, how can people find you if they are interested in doing that?
So I have a Psychology Today page. I have a website, which is CarynSherbetTherapy.com. I also am on my practices website, which is, I want to say it's TriskaPsychotherapy.com. Um, I think those are all of the ways. I am not hip enough to have like an Instagram or a TikTok or anything like that. I know some people do. I just don't have the attention span for it.
I have a therapy Instagram and I like low key hate it.
Yeah,
I actually stopped posting on it. So I mean, anyone listening, please follow me at my gay therapist. I haven't posted for a long time because I low key hate it.
yeah.
I like the podcast. I stick to what you like. But okay, will you send me an email with those links and I'll just put them. Perfect. I'll just put them in the show notes and that way people can find you. Um, so yeah, as we're ending, any final thoughts or final words of encouragement or wisdom that you want to give to people who are listening?
I think the sort of big thing is your feelings won't kill you, I promise.
Mm, yes.
You can feel them even when they're really big and scary, and they might be unpleasant. Don't get me wrong, but they're not dangerous and they won't kill you. Um, yeah,
Your feelings won't kill you, I promise. Such a good quote. Caryn Sherbet, everybody.
thank you.
And thank you so much for coming on the podcast. And for everybody listening, this has been Mind Body Medicine for Chronic Pain, and I will talk to you next week.